question is, a 68-year-old diabetic patient develops which of the following macrovascular complication after 20 years? Options are retinopathy, neuropathy, nephropathy and myocardial infarction MI. The answer is MI, myocardial infarction. Next question, identify the condition shown below. The answer is clubbing. Next question, HIV patient presents with following presentation. What is the staging of HIV? The answer is third stage. Next question, JVP image shows rapid XY descent and elevated overall. What could be the diagnosis? The answer is constrictive pericarditis. Next question, tracheal shift towards right and left-sided pneumothorax. What is the management? The answer is left-sided thoracostomy. Next question, a male patient presented with high-grade fever and headache. He was found to have protein level 220 mg per deciliter and glucose 35 mg per deciliter in CSF. He develops rashes as shown below. What should be the probable cause? The answer is Neisseria meningitis. Next question, a patient who is normal at rest but has discomfort on activities. Normal activities are slightly affected. The patient comes under which category of NYHA classification? The answer is second category of NYHA classification. Next question, a student who was eating the food of his hostel mess found to have developed hepatomegaly, jaundice. On the same time, all other students who were eating from the same mess developed similar symptoms. Which investigation is more appropriate to be done to find out the cause? The answer is IgM for hepatitis A. Next question, a patient comes to the emergency with fever and headache. Examination, he has neck stiffness, CSF analysis was done and opening pressure increased, proteins mild increased, glucose normal, lymphocytes increased. What is the most likely diagnosis? The answer is viral meningitis. Next question, a woman after hysterectomy presents with distended abdomen. What is electrolyte imbalance seen? The answer is hypokalemia, decrease in potassium. Next question, identify the condition due to the image shown below. The answer is hypercholesterolemia. Next question, a 12-year-old child having proteinuria 4+ and edema and features associating with nephrotic syndrome without hematuria. What drug would you prefer? The answer is prednisolone. Next question, patient with previous history of MI 3 years ago now presenting with tachypnea, tachycardia, S3 heart. What could be the diagnosis? The answer is congestive heart failure. Next question, a patient is allergic to wheat and unable to eat. On examination, he was tested positive with anti-endomysial antibodies. What could be the diagnosis? The answer is celiac spro. Next question, a 75-year-old female has a problem in walking long distances. On examination, bruised here in knee. On X-ray imaging, reduced joint space and osteophytes were seen. Most probable diagnosis is osteoarthritis. Next question, a 65-year-old patient presents with dementia and loss of cognition. Which is the most common cause for this condition? The answer is Alzheimer's disease. Next question, note an early complication of cancer. The answer is blood loss from normal fissures. Next question, a patient presents with the following condition as shown below. What could be the diagnosis? The answer is venous ulcer. Next question, a patient who was admitted in neuromedicine department was asked to copy the image as drawn by the doctor. Image drawn by the doctor is shown in left side and the by patient is on the right side. Which of the following best describes the condition of the patient? The answer is hemi-neglect. Next question, a female after cold exposure developed following condition of fingertips as seen in the image. What could be the condition? The answer is Buerger's disease. Next condition, Dollmann's procedure is used for. The answer is pharyngeal pouches. Next question, a man presented with vomiting, nausea and fever. He was admitted for appendectomy after diagnosing appendicitis. During surgery, surgeons found an incidental finding as shown below, which was present at a distance of 2 feet from ileocecal junction. What is the most likely to be? The answer is Meckel's diverticulum. Next question, identify the image. The answer is loop ileostomy. Next question, a player injured with ball and suddenly lost consciousness. When one of the teammate comes for helping, he gets up by himself and starts playing. During tea break, the person was again unconscious while his friend saw him. Immediately, he has been rushed to the hospital. What is the most probable diagnosis? The answer is EDH. Next question, identify the instrument shown in the image. The answer is Babcock's forceps. If you are interested in more obscene instruments, you can watch my video. Next question, identify the image, prayer sign. Next question, a woman presented with the following lesions through which purulent discharge was coming out. What is the most probable diagnosis? The answer is tuberculous lymphadenitis. Next question, a patient after RTA presented to emergency and following procedure is done to maintain the airway. Identify the procedure shown in the below image. The answer is tracheostomy. Next question, a bedridden patient developed fever, pain and pedal edema, which is related to. The answer is DVT, deep vein thrombosis. Next question, a patient presented with long-standing pain in the anal region. On examination, the finding shown is given below. What is the most important thing to look for an per rectum examination of this patient? The answer is fistula in ano. Next question, identify the image shown below. The answer is phyllodes tumor, leaf-like structure. Next question, a 20-year-old female presents with mobile 2-3 cm lump in her left breast. Lymph nodes were not involved. What is most likely diagnosis? The answer is fibroadenoma. Next question, a surgical incision was made over the patient's chest and after some time he comes with the shown scar. What is the diagnosis? The answer is keloid. Next question, a 5-year-old child presents with the swelling shown below, which keeps on increasing in size. What should be appropriate management for this condition? The answer is excision. Next question, which of the following is a SERM? The answer is tamoxifen. Next question, which among the following is a monoclonal antibody used for the treatment of cancer? The answer is rituximab. Next question, a patient was taking theophylline for bronchial asthma. After starting another drug, symptoms of theophylline toxicity started appearing. Which is likely drug to cause theophylline toxicity? The answer is erythromycin. Next question, antidote used for heparin toxicity. The answer is protamine sulfate. I already uploaded dots and antidotes. If you are interested, you can watch that video. Next question, find out the best treatment for the given condition. The answer is vanciclovir. Next question, a patient presented with hospital acquiring pneumonia. On testing, he was found to be allergic to penicillin G. Which of the following drug is likely to be safe in this patient? The answer is aztreonam. Next question, a new drug is introduced in the market after which phase of clinical trial? The answer is third phase. Next question, a 65-year-old patient presented with dribbling of urine with urgency. He was started on prazosin therapy but started developing postural hypertension. Which of the following is the better alternative drug for this patient? The answer is tamsulosin. Next question, a mother is suspected to have a premature delivery. Which of the following drug could be helpful to attain the lung maturity before birth? The answer is dexamethasone. Next question, all of the following conditions get votes after timolol maleate 0.5% administration except. Options are bronchial asthma, hypertension, depression, diabetes or glaucoma. The answer is hypertension. Next question, ibuprofen may increase serum uric acid. What is the mechanism for this action? The answer is it inhibits reabsorption of uric acid. Next question, a patient presented with shock in emergency. Which drug you would be giving after stabilizing the patient? The answer is adrenaline. Next question, a patient presents with 4 months history of fall, come with swelling and pain around the knee. The following X-ray is obtained from the patient. What is the most likely diagnosis? The answer is patellar fracture. Next question, identify the condition shown below. The answer is chondrosarcoma. Next question, which of the following is the most radiosensitive tumor? The answer is Ewing's sarcoma. Please do share these videos. Next question, identify the given image. The answer is talar brace splint. Next question, which fracture is shown in the given X-ray? The answer is Galeazzi fracture. Next question, which is the IV anesthetic drug used for daycare surgeries? The answer is propofol. Next question, a patient after RTA presented to emergency department with hypovolemia. Which of the following cannulas can be used for most rapid blood transfusion? Options are gray, orange, pink or green. The answer is orange. Next question, an anesthetic was trying to put central line. What is the best method to confirm the accurate CVP insertion? The answer is high PCO2 in venous blood. Next question, which of the following drug is associated with post-operative delirium hallucination? The answer is ketamine. Next question, which arterial territory is involved on this CT scan image of a patient with infarct? The answer is complete middle cerebral artery. Next question, identify the pathology in the given ultrasound image. The answer is multiple gallstones. Next question, local anesthetic agent works by which of the following mechanism? The answer is blocking sodium voltage gated channel. Next question, identify the structure marked in the given image. The answer is lentiform nucleus. Next question, patient comes to emergency room, vomiting and colicky abdominal pain. On investigation, following image is obtained. Likely diagnosis is horseshoe kidney. Next question, a cattle handler from a village with cough, hemoptysis and chest pain underwent a chest radiograph and is shown below. What is probable diagnosis? The answer is hydrated cyst. Next question, a person at the airport with symptoms shouting agitations showed following X-ray findings. He was carrying enema apparatus and laxatives. Which of the following is a wrong statement? The answer is he is malingering. Next question, what can be the diagnosis for the given image? The answer is foreign body. Next question, a patient presenting with breathlessness, pedal edema, gives a history of myocardial infarction few years back. A chest radiograph is taken and shown below. Likely diagnosis is pericardial effusion. Next question, identify the given image below. The answer is hydatiform mole. Identify the image. The answer is bilateral hydrosalpinx. Next question, a patient presenting with epistaxis was diagnosed with juvenile nasopharyngeal angiofibroma. What is the sign demonstrated in the given image? The answer is Holman-Miller sign. Next question, a patient with history of TB, prolonged back pain. The answer is psoas abscess. Next question, diagnose based on the given image below. The answer is PCOD. Next question, identify the condition based on the given radiograph. The answer is rickets. Next question, a 6-day-old neonate with respiratory distress showed the following findings on chest X-ray. The answer is congenital diaphragmatic hernia. Next question, a 2 weeks child brought to emergency room by her mother with symptoms of non-bilious vomiting and lump in the epigastric area. What is the most appropriate diagnosis? The answer is congenital hypertrophic pyloric stenosis. Next question. Female visits OPD with her 6-week child presenting with vomiting, abdominal pain. X-ray of the infant shows duodenal atresia. Next image-based question is slipped capitofemoral epiphysis. Thank you for watching the video. Follow us on Instagram and Facebook and share these videos as much as you can. Let's all be benefited. Thank you.